Let's talk about this fear with tearing with childbirth. Your body's created to birth your baby, and it will stretch just enough to have your baby given the opportunity. Hi, I'm Krisha, your natural birth trainer. If you have a birthing goal of natural childbirth, click subscribe so I can keep you in the know about natural childbirth. So first of all, I want to cover what the perineum is. The perineum is the bottom of the vagina, tissues that run down towards the anus. So this area right here will actually stretch with that relaxin hormone in your body, just enough for your baby to come out of your body. Let's go over some things that can cause an increased risk of your perineum tearing or maybe your vaginal tissues tearing. It's very important for you to get into the position that you want to get in to birth your baby. This actually will decrease your chances of tearing. If you are laying on your back, knees wide, because someone else told you that is the best position, or maybe that's their training on how to get you to birth your baby because it's favorable for them, it is not the most favorable position for you and your baby. It actually increases the chances of tearing because your pelvis can't move and open up enough, and your tissues actually can't stretch to accommodate your baby's head and body coming out. Another one is pushing too hard and too fast. You don't like the pressure down there. You feel your baby coming out. It's stretching you out. You might feel some burning. And if you push really hard and really fast just to get it over with, that doesn't give your tissues the opportunity to stretch and you can tear. If maybe you have an epidural and you're being coached and you're doing that purple face pushing, that's when you tuck your chin, curl over your baby, hold your breath, and bear down really, really, really hard as someone counts to 10. That can also cause a baby to come out through your body really fast and increase your chances of tearing. Your baby can also have a hand up by the head or maybe have fists underneath the chin, which will also increase the chances of tearing, which that one you really can't help with. There's also when the baby does the cardinal movement of the shoulders that come out, that it goes really fast and the shoulder will actually catch the inside of the vaginal tissues and the perineum, and it stretches it really quick and could cause tearing. Another one is the elasticity of your tissues, which means basically genetics. Will your tissues actually stretch or won't they? Another reason is diet. There is a tendency for vegans and vegetarians to have a higher chance of tearing just because of the integrity of the vaginal and perineal tissues. People who eat more protein in their diet, the integrity of the tissues are better and they have more elasticity in them, which decreases the chances of tearing. Assisted births like vacuum or forceps, or even maybe your provider gets in there and starts pulling on your baby's head and shoulders, that can increase your chances of tearing. Another reason could be the pelvic floor muscles. They can be very, very tight, or maybe tighter on one side than the other, or you can just have very fibrous tissues on the perineum that causes tearing during labor because the tissues just are unable to stretch. And the last one is you could just have that overwhelming urge to bear down, and when it comes time, you just bear down really quickly and the baby comes out quick, which doesn't give the opportunity of your tissues to stretch, and that can cause tearing as well. All right, so let's cover ways to support your perineum as the time the baby emerges from your body. First of all, most important is you got to get into the birthing position that you want to birth your baby in, not how you're being coached or someone else wants you to, because that's how they want you to birth your baby. You need to get in the birthing position how you seem fit to birth your baby at that point in time. Having your baby in water is another great way to give your perineum the support as your baby emerges from your body. Using breathing as a way to control and ease your baby out. So as your uterus is pushing your baby out, you breathe with great control, or you can also go or short little grunts. And some people will even horse lip. That way they're using their breath to control the baby coming out of their body as their uterus pushes. Your provider can apply perineal support with a warm, wet compress along the perineum as you breathe your baby out. Another option that you can ask your provider about is Paranal Massage, where they take some oil and they'll drizzle it on the perineum, and they'll apply it to their fingers as well with a gloved hand. And as the baby comes down, they will massage the perineum with their fingers to help stretch out the perineum as you breathe your baby down. The types of oils that are used for perineal massages at birth can be mineral oil or borage oil. And lastly, when your baby's head crosses the finish line, we still need the shoulders to cross for not to allow your provider to come in and pull on your baby's head and tug the shoulders out. We want to ask for a hands-off delivery to help keep our perineum intact. I also get a lot of questions about, should I do perineal massages at the end of pregnancy? I don't recommend it. Other mammals on this planet aren't getting perineal massages and their babies are coming out just fine. We're a mammal as well. Our bodies will stretch. We just need to allow our body to stretch, use controlled breathing, and our babies will cross our finish line. However, I do recommend one thing to help get the vaginal tissues and perineum ready. Basically, what gets you pregnant gets you unpregnant. Sex is a great way to provide that perineal massage to get your perineum, your vaginal tissues, and your cervix ripen for the time your baby's ready to step you up to the starting line of your birthing game day so you can run your birthing marathon and meet your baby across the finish line. If you want more knowledge about natural childbirth and how to condition your body and your mind to labor your baby across the finish line, nothing but natural, check out my workshops at trainforbirth.com. I look forward to training you soon.